Today we are at Black Hills Surgical Hospital with Dr. Mars. Talk a little bit about what you guys do here.
So what we do is surgery.
Sure.
We take care of patients within the domain of surgery.
Mm-hmm.
It's our desire here to produce excellent experience for our patients.
Mm-hmm.
Largely what we do tends to be musculoskeletal type of surgery, but we are a full service hospital. In the musculoskeletal realm, a lot of that is hip and knee replacement, and that's where I come in. I'm the director of the Hip and Knee Center. We got 7 surgeons who do hip replacement and knee replacement. But when a patient gets to the point where non-operative management isn't making them better, then they come see an orthopedist.
And now today we're talking about the new hip stem replacement. So why don't you talk about this?
Yeah, this is the newest stem on the market, and this works very well in our hip and knee center. It integrates nicely with the robot. One of the nice features about the robot is it allows us to more accurately design how we want the new parts to look, fit the patient's normal anatomy, and then more precisely put those parts in. And this particular stem has some design features that allow us to put it in the bone with very little impact. It's safe for the bone, and it allows us to more accurately reproduce their normal anatomy to get their length right and make it feel right for them. The ultimate outcome that we're shooting for is less pain and better function. And we want to get them as close to normal, as close as pre-arthritic state as possible. And getting in a good part and putting it in properly are a big part of that. But there's a lot to it. The patient really is the most important part of the team, and what they bring to the game matters more than anything, and doing the physical therapy really helps. Precisely what we're looking for, better quality of life. One of the things that's special here is our robotics. We're using the Stryker Mako robotics, which allows us to do total knee replacement, partial knee replacements, and total hip replacement. And this particular stem that we're using here is still in its pre-market release. It's not officially released to the public. We're one of the first places in the country to use it for our patients, and we've had really good results.
And now we are joined by a patient at Black Hills Orthopedic and Spine. This is John. Thanks for joining us today.
After the shock, my own personal shock of being this very fit 70-year-old former firefighter, that I'm going to have some new bionic hips. The actual pain of the joint is gone. The pain of the incision and how the body recovers is a process.
But you feel better though.
Oh, absolutely.
So I feel like this type of service is a good asset to the community.
I like to think so.